Welcome to Psychology Social Hour, hosted by the St. Joseph Museums. My name is Shelley Haynes, and I'm going to read a brief disclaimer before introducing our guest. This free virtual series features an educational program on a topic of mental health. This event is for generalized information and is in no way a form of diagnosis. Please consult with your doctor or therapist for specific medical or psychological advice. We are merely starting the discussion to help destigmatize mental health. Mental illnesses, symptoms, diagnosis, and treatment methods are all a highly individualized process. Tonight we have Ms. Stephanie Malita with the Health Department and the Buchanan County Opioid Taskforce. So, Stephanie, here you go.
Thanks, Shelley. I appreciate it. As Shelley said, I'm Stephanie Malita. I'm with the City of St. Joseph Health Department, where I have been worked in the administrative offices and as a health educator for almost 25 years. So been around there for a little while. And I have been involved with the Opioid Task Force since its inception. And I'll give you a little history of that. But I wanted to thank Shelley again for inviting us to be part of this. We are thrilled to be featured on this program. And we hope that the information that I share today may inspire some of you to join our task force. We are always looking for new members, and we welcome really anyone from any walk of life to join the task force. And I'll explain a little bit more later about who we have on the task force at this time in terms of organizations. But for now, let me tell you a little bit about the history. Back in 2017, Governor Greitens at the time had identified fentanyl as a harm in our state. And there were a number of opioid overdoses, and he was seeing those numbers rise. And he put together a task force at the state level and asked, I believe it was 11 communities around the state of Missouri to host an opioid summit. And St. Joseph and Buchanan County were selected as part of that group. And a core team at the health department, Nancy King and myself included, put together a summit, an opioid summit. And at that summit, we had speakers for, I believe that one just ran in the morning. And so we had I think we offered a breakfast. We had speakers come in from the state. The governor wasn't able to make it, but he had a stand-in come and talk. Oh, and he had a video. We played a video of Governor Greitens talking about the opioid crisis that was occurring in Missouri at the time. And little did we know at that point that that was just the beginning. It was only going to get worse. But we had specialists from the fields of treatment and recovery also come and speak to us. We had a local person in recovery talk to us about his journey and how he turned it around, and now he's a leader with Narcotics Anonymous, and he's led a number of people into recovery and help them stay in recovery. So we were really blessed. We had 400 people register. It was free to participants. The state gave us some funding to host this thing. We had it out at Missouri Western at the Fulkerson Center. And so of the 400 people who registered, I think we had about 350 show up. So we had some people that weren't able to make it the day of, but it was a full house. It was very well received. And what grew out of that was a survey that we offered at the end of the program. We asked people if they would be interested in carrying this work forward. And that was the beginning of the Buchanan County Opioid Task Force. So we had a number of people from treatment and recovery, from education, from the hospital, from law enforcement, all facets of law enforcement, including probation and parole, We had people like Shelley that joined us too. And we came together and we started meeting monthly. And we created a flyer for to inform people about the Good Samaritan law that we have in Missouri, the don't run, call 911. And that was very important initially to some of the members of the task force who had lost children because somebody left them there and they were afraid to call 911 and get help. And so we wanted to make certain that that message was received within our community, that people knew that they would be protected if they were trying to save a life. And that's across the board too. We, for our purposes with the Opioid Task Force, we want to make certain people know that in terms of people in an overdose situation. But that's also true if you come upon a car wreck or somebody at a ball game that's passed out from heat exhaustion. If you offer help to somebody, even if you're in a compromising position legally, you're not, the police officers and first responders will not, you won't be punished for that act in the state of Missouri. So that's really good to know. Now, that said, there are some caveats, and if there are outstanding warrants, and that's something that that we've heard from this community, is that if there are outstanding warrants, they will be arrested. But we still encourage people to call 911, stay with that person as long as possible. When they hear the sirens approaching, if they want to leave them at that point, that's fine. But stay with them, give them CPR if that's what they need, give them Narcan if that's what they need. Because ultimately we just want to save a life. We just don't want to have another death, another missed opportunity for recovery. And so that was the main purpose behind promoting the Don't Run, Call 911 message to our community. We also focused a lot on the people behind this epidemic, and feel like that was a great place for us to start with the task force, because it really made us, those of us that don't work in that field and haven't been touched by addiction in this extreme manner, it helped us understand what it is that people are dealing with, what it is that our community needs in terms of help. And it really helped introduce us to each other. Because when the task force first began, there are many treatment and recovery centers in our community. And they, from what we understand, and we're just the health department, so we're not really enmeshed in this system of care. But from what we were told and the feedback that we got when we began the task force is that these treatment and recovery centers began talking to one another more. So if they had somebody in treatment that wasn't responding to the type of treatment that they offered, they now knew a face of another location that their patient might do better at. And they started, sharing that information with their patients in a more consistent manner. So we feel like that's a big win if people are getting the assistance they need, even if somebody is having to give up a patient and share that patient with another entity. That was a big win for us. We were really, really proud of that. So moving forward, some of the things that we did were kind of make sure that our community was aware of some of the national and even international awareness days. So we began planning for things like International Overdose Awareness Day, and that happens at the end of August. We had Black Balloon Day, which is March 6th. Recently, I think we just had the second year of it, National Fentanyl Awareness Day, and that is May 9th. So we bring our community together for some events like this. And we always encourage the task force members to have a table at the event, to have information about their services. Most of them will pass out Narcan. So participants or attendees can take Narcan with them and take, information about how to use it. And so they're prepared and armed to save a life if need be. Some of these events they've all been successful in our eyes, but some have been more successful than others. The International Overdose Awareness Day is always a very somber event. That is on August 31st. And we have kind of rolled it over into a candlelight event in August. It's still light outside, pretty late. And we do host all these events outdoors. But the last couple of years, we have started the event a little bit later in the evening so that we can finish with we have purple lights, flashlights, and so we just kind of have silent time where we are remembering people. We offer the opportunity to sort of set up a little memorial at different tables. We offer an open mic so people can share stories. And at these events, we always hear stories of recovery, as well as stories of lives of people who we've lost, but what they did in their time here with us. And it's always very, very moving. We really, it's just such a warm way for everybody to get together and share these stories with one another and share support with one another. We also talk then about support groups. So we can, people that attend can find those connections if that's what they need. So some other background on the task force. One of the things that we did early on as well is we hosted a Missouri peer support specialist training. So we had that at the health department in our conference room, and it is a 5-day training. It's very intensive. It's all day, but we brought, I think there were about 20 to 24 people that attended. And I think there were at least half of those were St. Joseph residents. And then they were able to get work in treatment and recovery centers that were hiring peer counselors. So it was a really great training and helped people understand kind of what their lived experience meant, and maybe help them figure out where some of the basis of where that where those behaviors and where that addiction and where the disease came from within their family and within their lives, and then how to use that lived experience to help other people. So it was a really great training session. And since then, we've had 2 additional recovery support specialist trainings, which are for people in the community that want to help, want to be part of that treatment and recovery system of care, but don't have lived experience. So both those trainings have been very well attended. We had 40 attendees at a training we had last year, and I think close to 30 on one that we had this year. So there's still definitely a need in our community for those types of trainings. And we are hoping to put together another peer counselor training within the next year. So look forward to that too. So that was 2018. And then 2019, people started getting antsy in the task force, members of the task force, and saying, hey, this is great, but let's do another summit. We need another summit. We need an update on where the state is, new things that are happening, and what is, because by then we could see that this was snowballing. We could see that that overdoses were happening more and more frequently. The numbers were going up instead of down. So we spoke to the state, and by then we had a grant to help support the task force. We requested that we be allowed to use some of the funding to put on a second summit. And so we did that. And this time we had speakers, but we also had breakout sessions. It was still just one day, but people could select, do I want to hear about law enforcement from like a DEA agent, or do I want to hear more about treatment and recovery resources? So we had, I don't remember exactly how many, but I think we had about 5 or 6 different breakout sessions. So people could select who they wanted to listen to. And again, we had in the main Fulkerson Center, kind of a ballroom sized space, we had everybody come together for an opening speaker or a couple of speakers do breakout sessions and then came back for closing sessions. So, and again, we had around 300 attend that one. And it was, at that point, I feel like it was people who were not just curious, but they were really serious about being part of the solution. So it was kind of a different audience, some of the same, obviously, but we drew in some new people too. And then after that, we had COVID. And so the health department was obviously very entrenched in the COVID response. So we stopped having our opioid task force meetings at that point for probably 1.5 to 2 years. The problem didn't go away though, as we know. So we came back together, I believe in March of 21, or maybe even 20. And we had a fantastic meeting. We met out at Remington Nature Center, where we can host a larger number of people than what we have space for at the health department. And so it was a fantastic turnout, honestly, standing room only. I mean, we had all the seats filled and there were still people coming in. So we had to move some chairs in that were not at tables, but it was, we were really excited to see the response that we got from our community. And so from that point moving forward, we just continued to have monthly task force meetings. We have, in addition to the main task force meeting, we have subcommittee meetings. And so through those, we address topics like maternal substance use disorder for women who are pregnant. And that is run, that is headed up by somebody at Women's Health out at Mosaic. We have a youth subcommittee, and that one is, we work with the school district, and Youth Alliance is very much a part of that. And we, for that one, we talk about prevention for youth, and working with the schools to get into the schools. It's very difficult to get into the schools because they have such a tight curriculum. It's difficult for them to introduce new material or allow outside entities into the classroom. That has gotten more and more difficult as the years go on. The health department used to have a health educator that went into the schools pretty regularly, but that's been a number of years. And like I said, with kind of the testing requirements and the attendance issues that the school district has faced, it's been very difficult for us to get into the schools with outside curriculum. So we've had to be a little bit creative. One of the things that we did for Fentanyl Awareness Day, which is the one that's in May, this year we decided to create a little bit of a different event because we wanted it to be a true awareness day. Typically when we have these events, our partners in the task force are fantastic about attending, bringing their clients with them, having a table set up with resource information. But we really wanted for Fentanyl Awareness Day to open it up to a whole new audience. We wanted to bring in people that were unaware of how kids get drugs. And we wanted them to know that when they do seek drugs, that there's a high likelihood that they're going to get something that has fentanyl in it. If they're looking for Xanax online, drug cartels have pill presses. They make drugs that look like pharmaceuticals, and it is so difficult to tell them from the real thing. And kids get online and use apps to like Snapchat, not to call them out entirely because other apps are used as well, but they use emojis in very creative ways. But they use emojis to let someone know what it is they're looking for. And that person says, yes, I've got it. Here's the price. They meet up, and suddenly a teenager has access to drugs that may have a lethal amount of fentanyl in them. So we want parents to have this information. We want them to know what's going on, to know that if their kids are using these specific emojis, that it may be that they're looking for drugs, and they need to be aware of where they're hiding them in their room. And I mean, kids order cans that look like Coke, but it's got a false bottom, and they hide stuff in there. I mean, it's crazy. I mean, they're, like I said, very creative, but we want them to use their powers for good, not drugs. And that's what we are trying to get across when we have these events. So anyway, back to National Fentanyl Awareness Day. This past year, we created an event called Make Some Noise. And we invited youth who are involved in music to audition and perform at this event. And our thought process was, if it's kids, their friends will come see them, and likely their parents and families will as well. And it'll be entertaining. It'll be more fun than just having all of us old fuddy-duddies stand up there and talk about fentanyl. So we got to work on this. We were very excited. It ended up being, I considered it to be a highly successful event, but it rained a little bit early on. So we didn't have as great a turnout as I was hoping for. And initially, we really struggled to get kids to turn in the application. We ended up having just a couple go through the process that we had set forth, which was just to send us this application that we created. And we asked them to send us links to their social media so that we could sort of check out what they'd done in the past. And so we ended up having to go actually track some kids down so that we would have enough performers. And we had the drum line from Mid-City Excellence. They were fantastic. And so actually they opened it for us. So we would have a performer play for anywhere from 15 to 20, 30 minutes. And then we would have a speaker. So we had Emily Sweet from the EMS service. She got up and talked a little bit about being an EMT and what that looked like for her responding to calls that involve overdose. And she went through how to use Narcan. So that was really informative for our audience. And many of the tables had Narcan available. So that was awesome that we could show them how to use it, but also have it available for them to take. And then we had another speaker, actually two speakers that talked about their personal story. And that's always very moving. And we really appreciate that they are willing to share to the level that they are, because it's very emotional. And so we love having that that testimony at events like this. And so we had that, and then we had one of the school board members spoke. And so we would have, like I said, we would have a performer, and then we'd have a speaker, and then a performer and a speaker. And so it went on like that. It lasted a couple of hours. We had Will Stuck, who used to work for the St. Joseph Public Library and was the kids and youth librarian, and he would do summer courses. And he has since gone out on his own. He is highly entertaining, and he travels around and does kind of reading programs. And he calls himself an edutainer because he always has an educational message, but he presents it in an entertaining way. And he's really fantastic. We were very fortunate to have him be part of it. And then Jason Johnson, who's a local musician, helped us by running the sound, and he provided the speakers and all that, so that we had that that sound system that the kids could plug into and do their performance. So like I said, it turned out to be a great event. People really enjoyed it. I think we'll do it again next year. We kind of figured out that the timing isn't great. May 9th is when kids are wrapping up their school year, and they are involved, especially kids that are in music. If they're in music at school, they are in the state music competition. That's when that occurs. And so if they are involved in that, they're just not even available. So we can't change the date of a national event. So I'm not sure how we're going to get around that next year, other than maybe start a little earlier. I feel like we started early enough. We probably sent out notifications maybe 5 weeks before the event. And we hit up the school district, sent it to the counselors in the high schools and middle schools. We asked them to forward it on to the music and arts performing arts instructors. So, and we talked to Lanham Music because they have a youth program, and they have lots of kids that come to them for lessons. So I'm not sure what we can do differently next year, but we are definitely going to do our Make Some Noise for Fentanyl Awareness Day again, because it was a lot of fun. It was a lot of work, but it was a lot of fun. And like I said, it was just something different. We wanted to do something that wasn't, that was a little bit out of the norm. And, I feel like too, as we do it year after year, it will gain traction just because kids will know about it. And hopefully want to be part of it. So that was just this last May, and coming up at the end of August. So in about a month, we'll have International Overdose Awareness Day again. And we've been having these events at Felix Street Square. International Overdose Awareness Day we have held at City Hall on the back steps, where the Red Rally is going to be on Saturday. There in Civic Center Park. But we shifted over to Felix Street Square. It just feels more natural there. That's a place for, because it's not a huge event. So it's a good size for us. And I imagine that's where we'll have Overdose Awareness Day again. Okay, so some of the members of the task force. I'm going to cheat a little bit and look at notes. But we have had the hospital. So Mosaic has been part of the task force really from the beginning, in different different departments have been represented. We used to have somebody that worked in treatment that came, and then I'm not sure what happened there with, I wonder if she hasn't really been back since COVID. So maybe her duties shifted a little bit. But so the hospital, family guidance, St. Colby Puckett, treatment and recovery, or Center for Healing, St. Colby Puckett Center for Healing. New Seasons, which is St. Joe Metro Treatment Center. De Novo came for a while. They haven't been at meetings for a little while, though. I'm not sure if it's not a good fit for them anymore. They're just busy enough to where they don't have somebody available at the time that we have our task force meetings. I said I was going to cheat and look at notes, but I'm not finding the list. Here we go. Oh, the emergency department. We have somebody that comes from Mosaic's emergency department, and he has been sharing some data. So that's been really good to have. That's one thing that we've always struggled with is the way that that a death is coded, because ultimately it's often heart failure or pulmonary failure, and it's not always coded with a toxicology report. So we don't know. We feel like we're probably missing some numbers, but having the emergency department involved is really helping us identify emergency visits. We just haven't had those numbers before. We can get them from EMS, but not all people, they often, well, I don't know often if that's the right word, but they have responded to calls. Somebody is revived and then they refuse to go to the hospital. So we also kind of need to capture the EMS numbers, and we do get reports periodically from the coroner's office, the medical examiner, but it's that data is a real issue, and we're hopeful that we can identify a system to track those numbers. But because there's so many different entities involved in collecting those numbers, that makes it difficult as well. Okay, so hospital, Anna, she's with hospital. We have somebody from the sheriff's department that comes, that's part of the drug strike force. We have social welfare board represented. We have several people that are community members. We have people from the YWCA. We have a HIV case manager from Andrew County. I already mentioned them. We have representation from the center, from Youth Alliance, from the Pentecostal Church, from the St. Joseph Police Department, from the school district. We have often both their head nurse and their head counselor will be at these meetings. Missouri Western actually hosted the meetings for a while, because when we were coming back after COVID, we were still trying to maintain that social distancing, and we didn't have the space to do that, but they did with their larger classrooms, and they had the ability to broadcast it via Zoom. So we were fortunate to partner with Missouri Western, and they helped us through some of those barriers that we had to hosting the meetings again. Shelley, can you think of anyone else that I'm missing? Throughout the years we've had a chiropractor in the past. Rogers Pharmacy comes. They came at first and then kind of dropped off, and now she's been back again.
I can't think of anybody else. Hughes Chiropractic.
Yeah.
I sat with him on that second summit at a table.
That's right. Yeah. Well, and he kind of he was sort of the leader. He would run the meetings for that first year or so. And again, I'm not really sure why we lose people. I think I mean, maybe his practice grew. I know that was one of the things that he was really concerned with is alternatives to pain medication. Because back when this first started, that was, of course, one of the largest contributors to this epidemic is people overusing pain medications and then getting to the point where they were entirely dependent on them, and then they didn't have them anymore because they were healed from their physical pain, but moved over to using drugs that were cheaper and easier to get. Trying to look at a list of things recently that we have done. So some things moving forward. There are some years ago there was tobacco settlement funds, and where the big tobacco companies were required to pay states funds to address tobacco addiction, and some of that money got squandered. It wasn't really mandated that it be used for tobacco prevention measures and treatment for people that were suffering from chronic disease brought on by smoking. But now that opioid settlement funds are coming down, the states are requiring more of that money to be used to actually address this opioid epidemic that we're facing. So we've had some meetings. It's really tricky because the funding is coming from several sources, and I'm not sure what kind of formula they're using on to distribute the funds, like what counties get funds, and how much they get. I know in St. Joseph, the city will get some funding and the county will get separate funding. We are working together to determine how that's going to be distributed within our community. So we've had multiple meetings, and Mosaic has kind of spearheaded some meetings as well to help us to help guide where some of that funding will go. So we're in the midst of that. But one of the University of Missouri at St. Louis has an addiction science team, and they've already received some of their opioid settlement funding. And what they've decided to do with it is supply the whole state with Narcan or naloxone. So one of the things that has already started in the state of Missouri is organizations can contact, and I think actually individuals can as well. They just have a webpage that anybody can go to and make a request to be provided naloxone. There are some reports that organizations who use it or who request it, there are some reports that we will have to complete. I'm not sure how often those happen because the health department I think just this week, we put in our first request. So I'm anxious to get that started. I know there are some organizations within our community that have already started receiving the naloxone from USML, but they have used that at some of these events that we've had. They've been able to distribute it, and we will give it to anybody that comes in and asks for it. So, and I provided it. We've had a supply of naloxone in the past, but we purchased it with grant funds at that time. And so I provided it to one of our libraries who asked for it. Rushville Schools or DeKalb High School, the SRO there had asked me for some. We've had individuals come in and ask for it. And it's just gratifying to know that we have it available to give to people. And they can carry it with them. And one of the gentlemen that has spoken at several of our events tells his story, and it starts with him being, as on death's door in a parking garage here in St. Joseph, and a total stranger happened to have naloxone with them and saved this man's life. And now he's a peer counselor, and he helps other people get and stay healthy. And so it's naloxone does save lives, and we're happy to be part of that process. So trying to think what else we've done. Oh, we've got billboards and bus wraps that talk about the DEA, the Drug Enforcement Agency, actually came up with this campaign, One Pill Can Kill. But in talking to law enforcement and first responders in our community, it's not just pills. So we changed the verbiage to say one time can kill. So that's what our billboards and our bus wraps say. And we are looking at some other options moving forward, coming up with some new campaigns, whether we create it or hire an agency in town to create it, or find something that is already made that we can just put our logo on. We have a website. It's not great. We need to kind of redo it. We have resource guides that we have created. We have different handouts, like pens and football stress balls, keychain, lanyards, different things like that have the 988 crisis line on them. And so we're doing the best we can to reach out to our community. We just need events like this to help us spread the word and just get the message out in a wider fashion, so that we can have more involvement and put an end to this. It's completely avoidable. It's completely preventable. It's unfortunate that we're having to deal with this. I will say at this point, and it's very, very early, so it could just be a blip in the numbers, but our numbers are starting to decrease, it seems. The last couple of months, the reports that we've gotten from the emergency department keep dropping little by little. But that's all it takes, is just, even if it's baby steps, we're happy that we're making progress. So I guess to wrap up, I would like to invite anybody that is listening to our task force meeting. It is the Buchanan County Opioid Task Force. We meet at Family Guidance at 724 North 22nd Street, just north of Frederick, at noon on the second Thursday of the month. And anybody is welcome. We would love to see new faces in our midst. If you leave a message attached to this live stream with an email address, we can send you an invite if you'd like to attend by Zoom. We don't broadcast it, but we do have a Zoom link available.
Wonderful. Thank you very much. That was very, very informative.
Well, Shelley, thank you for the opportunity. And we really appreciate your participation you've been a member from the beginning, and know that it can be hard to come, but we appreciate everything that you do to support us.
Thank you. Thank you.
Absolutely.
And I hope the numbers continue to decrease. That would be wonderful.
Yeah, it would.
Yeah. It would. Okay. Well, I think that's all we have for this evening. So we certainly appreciate your time and effort, and hopefully we'll get the word out
Thank you.
more.
Thank you so much. Thank you for doing this series. This is really interesting.
You're welcome, and feel free to jump on anytime. It's the fourth Thursday of the month, every other month. So
Okay.
yeah.
So the odd months, the fourth Thursday of the odd month.
Yes,
this-
of the odd months. It'll be next September, or
Okay.
September for the next one.
All right. Sounds good.
Okay. Thank you so much, Stephanie. Have a
All
good
right.
evening.
You too. Bye, Shelley.
Bye-bye.